My name is Katelin Holmes. I'm a breast surgical oncologist with Infirmary Cancer Care at Thomas Hospital. I would say the first part of getting a mammogram is getting it ordered and scheduled. Sometimes that's the biggest barrier to care I see, where people are just afraid or nervous, and it can be anxiety producing. But I would say the actual amount of time that you're in there getting films was only about 7 minutes. It's very quick. I did it on my lunch break in the middle of a busy clinic day. It was not painful. It was actually a pleasant experience. I had a really good mammography tech who helped walk me through the whole procedure and where to stand and where to put my arms and when to hold my breath. And I can say with complete assurance that I'd absolutely recommend doing it. It wasn't anything that was honestly a big deal. This was actually my second mammogram. I previously had a mammogram for something that I felt on my self-exam that, thank goodness, turned out to be benign. I actually have a family history of very young breast cancer in a relative, so I decided to be proactive with my health and felt the importance to start earlier. I hear a lot of misconceptions about mammograms. I think one of the biggest things that I see frequently is the fear of radiation. The amount of radiation you get from a digital screening mammogram is very, very small. I always reassure people that the minuscule risk of radiation is tiny, but the great benefit of catching an early breast cancer greatly outweighs the theoretical risk. I also see a lot of patients who are afraid that it's going to hurt. When you go to a place and you have those fears, it's important to talk to the tech that's taking your films and let them know they're there to be your advocate and get good pictures of your breast. I think the other big fear that I see from patients is always, what if they find something? That's a fear with a lot of aspects of healthcare, is just the diagnosis itself. And sometimes, people can be very in tune with their bodies and have the sense that something could be wrong. Women that get annual screening mammograms have been proven by clinical studies to reduce the risk of dying from breast cancer by 40%. That's why it matters, because if there is something there, let's catch it when it's tiny and not wait till it's a big advanced problem. Even as a physician and as a breast specialist, I'm in a weird position to get a mammogram because you know how that can play out in many different ways. And so for me, it was having a sense of vulnerability in that process, a physician turned patient. And I'll be honest with you, I think as a doctor, it's good to be reminded of that feeling. Because what's important when we deliver care, especially in breast health, is remaining in touch with our human side and remembering these are real women with real lives behind all of these decisions and behind this film that we're looking at. It's a good reminder of even doctors need to be screened for cancer. We are an NAPBC breast program, which is a nationally accredited program. That means that it's not just myself. It is the role of a medical oncologist, a pathologist, a breast radiologist, a radiation oncologist, a plastic surgeon, patient navigators, patient advocates that all come together in order to formulate the best care plan for each patient. That's something really valuable and not offered at every hospital. I think the other important thing for patients to know is we have an affiliation with UAB. I'm actually a UAB breast surgeon, and I work here at Infirmary Cancer Care. And I think that's so wonderful in order to bring the big setting of an academic university and so many of those resources to have cancer care close to home. I practice by the NCCN guidelines, which is the National Comprehensive Cancer Network. That's considered the gold standard in our country, which says women should start annual screening mammograms at age 40. And you shouldn't stop them until this person gets to the age where they would no longer have treatment if a cancer were to be detected. However, there are some women that need to start younger than 40, and those are people that have young family members who were diagnosed with breast cancer anytime before menopause. You would want to start 10 years younger than the earliest diagnosis in your family. Ultimately, patients likely will get their results the next business day for a screening mammogram. And I think the Thomas Breast Center does a wonderful job when patients come in for a diagnostic mammogram or an ultrasound where they have a callback, even trying to involve the radiologist at that time to answer questions about a potential biopsy. And once a biopsy happens, we have a breast health navigator at the breast center, which is a really unique part of our breast center that a lot of places don't have. She will actually meet with the patients before the biopsy and after the biopsy and help them navigate forward depending on what that shows. While the majority of callbacks are going to be benign, some of them will lead to a further workup. And so what I also reassure patients is you can be assured that even in Fairhope, where it's a smaller town, you're gonna get extremely efficient and amazing care close to home. I think it's important for families to talk about breast health early, because for a lot of women, they don't realize they actually have a strong history of breast cancer in their family until they're diagnosed. My advice to a scared woman would be, think about what your future self would want to look back and tell you in this moment. It's a lot harder to live through the lens of regret of, I wish I would have done something sooner. I wish I would have listened to myself. I've seen women that have been dismissed by doctors where they felt like something was wrong and they were dismissed or not taken seriously. And I think it's really easy to be afraid of finding something. Breast cancer, when caught early, has an outstanding survival and prognosis, and women don't have to be in fear of this is a death sentence anymore. If I can make time for it as a busy surgeon in the middle of doing a lot of operations and seeing patients in the clinic, you can too. Don't let excuses like you're too busy or you have to take care of your kids or there's just not enough time in the day to stand in your way. It's a few minutes. It could save your life, and if I can do it, you can do it.